Welcome back, class. This is Unit 6, the residence living space, and a lot on bed making, admission, transfers, discharge. That's what's covered in this unit. Resident living space, the residence units are their homes, and residents have a right to privacy. You must always knock and wait for permission before entering a residence room. Chair and decorations from home are allowed. A lot of them you'll see all kinds of stuff that's brought from home, and that is definitely allowed. Here's a list of the basic standard equipment that's found in a residence room. They'll have a bed, a bedside stand, an overbed or tray table, a chair, a bath basin, emesis basin. Emesis basin is that little kidney-shaped thing that emesis means vomiting, so it's kind of a, they use it to spit in or vomit in or whatever. Bedpan, urinals for males, water pitcher and cup, privacy screen or curtain, and a call light. There are different kind of call lights. This is an example of one. That's a real old looking one. But most of them are plastic with a button on them. And for those that are fairly arthritic or have had a stroke and can't push that button, there's the soft touch. That's what that looks like. The overhead or the overbed tray or tray table is used for meals and personal care, and it must be kept clean. So you will see urinals on them, you will see things that shouldn't be on them, but it's for meals and personal care. And anytime you use it for personal care, like to do a bath, you're supposed to put one of the disposable pads on the tray underneath your bath basin or whatever. Bedpans, urinals, and soiled linen should never be placed on the tray table. It should be kept free of clutter. Bedpans, urinals, oftentimes they will stick them in the bottom part of the bedside table, but in a plastic bag, or sometimes they're kept in the bathroom. Urinals are usually hooked to the side of the bed frame, but shouldn't be on the tray table, although you'll see the residents put them there. Disposable equipment is often used to prevent the spread of microorganisms. Somebody who is on isolation, when they bring in their tray, they're going to bring it in with disposable, because that just helps with the spread of microorganisms. So sometimes they'll use disposable cups, obviously tissues, gloves, paper gowns, masks, disposable razors, and pads. So somebody who is on C. diff will not have a cloth pad. They will have a disposable pad under them, or should. So that way it goes straight to the trash and not to the laundry. Know the difference in the kinds of beds featured. Features that may be found in a facility. First picture down there is an electric bed, has buttons, raises up and down. There are fancier ones that I don't have pictured here, like an ICU bed usually will have a button at the end where you can get their weight. It has a scale built in. That second picture, you can't really tell, but that is an alternating pressure mattress. So the thing hanging on the foot of the bed puts air in and out to kind of alternate the pressure on the bed. That's for somebody who has real fragile skin. Bariatric bed means it's a special bed for usually over 600 pounds. There are weight limits on the bed. So if it's somebody needs a bariatric bed, it's usually sometimes for over 400, 600 pounds, they need that. And that last one is a manual bed. There's no electricity to it. You see the crank at the end. The crank is what rolls it up and down. And that one single crank in the middle is usually the one that brings it higher and lower. And then on either side of that is usually another crank that brings the head of the bed or the foot of the bed up. So one of the safety features it always reminds us of is you don't leave that crank sticking out like it is in the picture. It will fold back in where people don't walk by and hit their shins on it or trip over it. Types of bed making. A closed bed is there where everything's pulled up and closed. That usually is somebody who's it's ready for a new admission. If somebody who gets up in the morning and doesn't go back to bed till bedtime or maybe a nap time, they would go ahead and close their bed. Open bed is B, where it's folded down, waiting to receive the patient. So if you know you have an admission coming, you want to go roll down their bed. And so they look like you're expecting them. So you're going to fan fold the top sheet and blanket to the foot of the bed. Unoccupied bed is when the patient is out of the bed. A surgical bed provides safe, warm environment to receive post-surgical patients via a stretcher. So it's left open. The C is a surgical bed, so it can be so someone can be easily transferred from a stretcher. Occupied bed is a bed made while somebody is in it, and that's one of your skills that you're having to do this week. Yeah, there's a Hartman video that you need to watch on that. Bed making. Occupied bed is a bed made while the person is in it again. Unoccupied is a bed made with no person in it. When you're making a bed, you always make one side that's recommended to make one side of the bed at a time. These are the basic body positions that you can put the beds in. Prone, and these are on your test, so you need to know these on your quiz. Prone is laying on your stomach. Supine is laying on your back. Fowlers, would be high Fowlers, sit in a C, she's at a 90-degree angle. Semi-Fowlers is about 45 degrees angle. Lateral positions, laying on your side. Sims is laying on your side, but you're over a little more. Sims is a position like they used to give enemas. And then Trendelenburg is where you have the head of the bed lowered. And sometimes they will do that if somebody's blood pressure drops. Trendelenburg is supposed to be ordered by a doctor, though, so you guys wouldn't do that unless it's ordered. Then there's also reverse Trendelenburg that sometimes they leave the bed in. That's for people who have bad gastric reflux. Just keeps the head of the bed higher. Trendelenburg, the head of the bed is lower than the foot of the bed. It's for somebody going into shock or having a low blood pressure and does require a physician's order, like I said. Reverse Trendelenburg is the head of the bed is higher than the foot of the bed for gastric reflux and aspiration precautions, and it also requires a physician's order. Sleep promotes healing and healthy body function, helps decrease the risk of illness and disease, improves mental well-being, and promotes emotional health. So when somebody has a lack of sleep, they have increased irritability, and increased risk for illness and disease. Problems with sleep and long-term care are a thing because they are adjusting to a new place and roommate. Noise levels and lighting, there's snoring, there's shift changes, there's closing and opening doors, banging equipment, odor and ventilation issues, incontinence. So the smells can kind of keep them awake, so you want to kind of keep the smells down. Temperature, the temperature for long-term care facilities for the facility is supposed to be 71 to 81 degrees, but as we'll learn later, elderly have less fatty pads, so that's why they are cold all the time. So they may want lots of blankets or lots of layers when they're getting dressed. Anxiety, just a lot of different things can lead to the anxiety about their future. And then dietary, we have to kind of watch their habits. Are they having caffeine, chocolate, and stuff like that before bed? Guidelines for resident units. As a CNA, you want to keep their units neat and clean. Always keep the call light within their reach next to them. Restock supplies daily. Check equipment to make sure it's working and not damaged. Refill their water pitchers regularly. At least once in their shift, you're going to be filling their water pitchers. Remove anything that might cause odor or safety hazards. I mean, if you change somebody's Depend, I wouldn't put it in the trash can. Or you could put it in the trash can, but then take the trash out and put a new bag in when you're done. And that helps keep the smells down and in the dirty utility room where there's a lid on it. Report signs of insects or pests immediately. Leave residents' personal items where you found them. Okay, 5 safeties is a handout that is in your content, but I went ahead and just put them on here. Number 1 is your call light within reach. You're always going to leave the bed in the lowest position. Remember, we raise it for our body mechanics, but we have to remember not to forget to lower it. Side rails up if ordered. crank in neutral position like I showed you on the manual bed. And wheels are always locked, especially always during transfers. Wheels of the bed, wheels of the wheelchair. Focus on the resident's comfort, the noise level, odors, lighting, and what the CNA can do to promote all of them to help with sleep. Linen. For bed, you will have a mattress pad. That's listed in your book, but most of them do not use a mattress pad. Fitted sheet, a draw sheet, a flat sheet. Draw sheet is also sometimes referred to as the lift sheet. Flat sheet is your top sheet, pillowcase, and bedspread. Bath blanket is used for bathing and occupied bed and things like that for privacy. Remember these guidelines for bed making. Change bed linens when they are wet, soiled, or wrinkled, so they don't necessarily get changed every day when you're making your rounds. If something is soiled, you change it. Wear gloves when removing soiled linens. Remember in the video, when you're touching the linens that are on the bed, you have gloves. When you're touching the clean linens, you take it off. Gather linen in order of placement on the bed. Carry clean linen away from the uniform. It should never be touching your uniform. Never transfer linen from one room to another. Once it's in the room, it stays in that room until it's used. Place clean linen on a facility-approved spot. More things to remember about bed making. Use proper body mechanics. Look for personal items. Roll dirty linen away from you. Never shake linen. Place the used linen in the proper container. You can't throw it on the floor. You can put it in a bag, but you can't just throw it on the floor. Make one side of the bed first to save energy. That's the second time I've said that. That must be important. Wash hands after handling linens. And this is what the bathroom would look like. You see the red thing on the wall. That would be, they pull that when they are done in the bathroom. So when you're looking at the call light system, the light will be on outside the door if they've just put it on the room. If it is a bathroom light, it'll be flashing. So you have to remember somebody on the bathroom that needs help is priority. If you see that, you need to get there before any other call light. I mean, even before you start your shift if that needs addressed. Entrapment is when a person gets caught between the rails or the mattress. Person at risk are older, frail, confused, and restrained. And there is some lawsuits and some incidents where these kind of things happen, so you have to be careful. And there's probably one reason why with dementia and confused patients, a lot of times they just don't have rails on the bed. Those are not good pictures there, but is a thing you have to worry about. Another picture of a resident's bathroom. Okay, I'm gonna stop there.